Hey there, listeners. This is Mackenzie. We wanted to give a brief disclaimer before today's episode that the content in this episode is not intended as medical advice, diagnosis, or treatment. The use of the information on the podcast is at the user's own risk. Listeners should contact your doctor or other qualified medical providers for any medical advice. Now on to the intro. Please enjoy.
What's the thing?
The podcast.
Are we doing it now?
Are we doing it right now?
We're live. We're recording.
We're amazing.
We are amazing.
I mean, nobody else gets it, but
Me and you.
isn't that the truth?
Mm-hmm.
Who's taking the lead on this? 'Cause
You're taking the lead on this
okay,
one.
I wanted to make sure because I didn't want to step on toes.
Nope.
But if I have to, I will.
Get down to business, Carrie.
Hey, everybody. Welcome to the Much Madness podcast.
Yeah.
I'm Carrie Krushinsky,
And I'm Mackenzie Ice.
and we are here to discuss yet another movie. Mm-hmm. This week, it is To the Bone. So, when was the first time you watched this?
I watched it when it came out in 2017. Like,
Same.
I remember it being, like, Netflix was promoting it heavily, maybe not
Enough
heavily.
that we paid attention.
It came up on my screen, so whatever algorithm they were using, it put up there. I think it spoke to a lot of people's particular experiences to it. However, it highlights maybe some of the more extreme particulars of eating disorders. Because there's a lot of people that live with an eating disorder that are not like ones that we saw, the people that we saw on the screen. Mm-hmm. And side note, Carrie, did you know that when our episode of this podcast airs, it will be during National Eating Disorder Awareness Week?
I did not.
Yeah. So
is that next week?
no, it is Eating Disorder Awareness Week in 2025 is February 26th through March 3rd.
Oh, okay.
It's put on by the National Eating Disorders Organization. Their website is www.nationaleatingdisorders.org, and it's about just bringing awareness to this group of disorders, I guess you could say. It's not just about one, it's about the group of them, and I think it's to help people recognize maybe if they're suffering from it. And then also they have a lot of resources for family and friends to help people they know that they love and care about that have eating disorders.
That would be difficult because, well, we'll get into it later, but the sister makes the comment like, how hard is it to just eat something?
Yeah, I have a lot of notes about Ellen, the main character's sister, Kelly.
Yeah, I like Kelly.
I like Kelly too.
So, of course, with this episode, we want to mention that we will be talking about a difficult topic that if you struggle with it, an eating disorder, or close to someone who does, maybe just when you feel like you need to either fast forward or stop.
Right.
Listen to your gut on that.
Yep.
So this movie stars Keanu Reeves.
Yeah, he was, when I was looking up background for, he's definitely a favorite of mine in terms of actors, but he's also a great human being. Everything I read about him, yes.
He's kind. He's very
kind. He's kind, he's genuine, he's down to earth.
Okay, so the cast also has Lily Collins as Ellen, who is suffering from an eating disorder. Is hers...
I think she's just anorexia.
Okay.
Her eating disorder.
Because she made the comment that she couldn't make herself throw up.
There's a scene, actually a few different scenes throughout the movie where patients that are being treated for eating disorders are discussing things amongst themselves, making kind of light-hearted remarks about, their experiences.
Right. I can think of one scene that you might be thinking of as well. There was a character in the 80s on Saturday Night Live, Stuart Smalley, played by Al Franken. Oh. And he was like the self-help guy.
Yeah.
And he makes this comment, well, I got the binging down, but I never could purge. Mm-hmm. And I just thought that was the most hilarious thing. Probably because I hate to throw up, and But
isn't that what the character Kendra kind of says that in the movie too? She's there for a binge eating disorder, and she made a similar comment that she can't throw up. She's like, I wish I could.
Yeah.
Yeah, make my life easier, but
yeah, and I think it's funny because there are a lot of parallels to Girl Interrupted in this.
Yeah, there's
certain themes and certain things that are done that I'm like, I didn't know that was a trope.
Ironic that we picked this one.
But this also, has other amazing actors. You have Carrie Preston, who plays her stepmom, Susan. Lily Taylor plays her mom, Judy, who anything Lily Taylor's in, I'm pretty much going to watch.
Do you know what I'm thinking of?
What?
She was in an episode of Law & Order.
Everyone's been on an
Yes.
episode. I'm waiting for our turn to be on Law and Order.
So, Mariska, I'm ready.
Yeah.
I've been
please.
preparing for my whole life to be on Law and Order.
I've watched it for 25 years. Please, woman, call me. So Retta plays Lobo, who is the woman who lives in the house and checks on her. I'm guessing she's a nurse. Are you guessing she's a nurse?
When I looked up information about the movie, it says that she's the inpatient nurse.
Okay.
Yeah, she's doing all the nursey things in the movie, like checking their weight, preparing their meals.
Probably dealing with the feeding tubes.
Yep, and when she goes through Ellen's possessions, yeah.
Yeah.
Safety checks, making sure there's no harmful things in Ellen's bag.
Luke is played by Alex Sharp, who I've watched him in some British shows. And then Leslie Bibb, who I think is just fantastic. She plays Megan. And Pearl is Maya Eshet. Sorry if I'm pronouncing that wrong.
Right.
And Chloe is played by Hannah Hayes. And Brooke Smith plays Olive, who is Ellen's stepmom. She's married to Ellen's mom. Now, do you know where you've seen Brooke Smith before?
Grey's Anatomy. Is there something else?
Silence of the Lambs.
Yes.
She was the one
she was
who
the
was getting the
Congresswoman's
lotion.
daughter.
Yes.
Yes.
Yes, she was the one who was told to put the lotion in the basket so she didn't get the hose.
Nope. We probably should talk about Lily Collins.
That's the next thing on my list.
Okay,
yeah.
great. I'm jumping ahead.
No, go ahead.
Okay. Well,
Because there was controversy.
There was. So it had been, I guess, maybe not widely known, but she had told people prior to her taking on this role that had recovered from anorexia.
I saw an interview and she said she really struggled when she was 16. Those years, that late high school was the worst time for her.
I was trying to figure out if anyone else had been offered the role before they went to Lily, but I don't think so. I couldn't find that information. So I wonder if Lily auditioned for it knowingly, or maybe it was offered to her. You know, like how some actors will get offered things?
Yeah. I mean, and she's already a very tiny person.
Just like
Winona Ryder. When people imagine having an eating disorder, it would be a restriction of food, not an overabundance.
When we're looking at eating disorders, we're looking at it from a disordered eating pattern. So whether that's restricting, whether that is purging, or if it's binging, you're consuming way more than you should in a sitting. There are psychological reasons and impulses why people do that.
And interesting to note, I've never actually seen my clavicles, so I'm not even sure I have them.
I can barely feel mine.
Yeah, I don't know if they're there.
But you know, when I was looking up this movie, trying to get more background information, I saw reviews on the movie, and one, which was by Hadley Freeman, it was in The Guardian. The title of it is, "To the Bone confirms there are almost, in parentheses, no good movies about anorexia." And she essentially is equating the movie to, like, anorexia porn. Those are like my words, I guess I would say, but she was basically saying that the way that Ellen is depicted, it's fetishizing, that it's a trend in Hollywood of fetishizing petite, very probably unhealthy women.
Like the waifs of the 90s who we saw.
That is exactly in the article. She was talking about how prior to the 90s, there was definitely a place for frail waifs in Hollywood, and they would get certain roles and things like that, but then after the 90s, it was cocaine chic and rail thin. That was the style, I guess.
Yeah, and once you got into low-rise jeans, it was like, oh, I need to make sure people can see my hip bones. I remember having friends who were like, oh, my hip bones look amazing. And I'm like, once again, I don't think I have those.
Right.
But it was always strange to me. It's like you want your bones to be displayed.
Right.
It didn't look healthy.
Hadley Freeman is saying that the movie glamorizes anorexia.
But part of the movie is that she has ended up like this, in part because she had a fan, she's an artist, she draws, fetishize Ellen.
Yeah, her work.
So I don't know, is there a reason for them depicting it that way so that maybe the audience kind of feels like
I think it gets brought up because that is a part of, like, whether you want to call it like eating disorder culture or just eating disorder common experience. I think, at least for the people who have an eating disorder, a lot of them have also what's called body dysmorphia. It's a diagnosis. It's not talked about really at all, I think, in the movie. But when we look at eating disorders, not everybody, because I can go into that a little bit more about maybe why people do have an eating disorder that's not related to body dysmorphia, but the idea is like they look at themselves in the mirror and they don't like what they see and they think that they need to be skinnier in order to be happier. Like that is what they're looking for. Basically, Hadley is talking about people aspiring to that and then you're putting it on the screen. And like you're saying, it comes up as part of the storyline. But I don't think I disagreed with Hadley. I don't think that was the purpose of the movie, is to glamorize it.
Because to me, I watched it and thought, oh my God, they're so, they're so horribly ill with this. Not only physically, but it is in the DSM, right? It's is. So that is considered, are they considered an eating disorder or mental illness?
Yeah, so it's got its own category.
Okay.
Yep, eating disorders has its own category in the DSM. I didn't see it as a glamorization. Maybe it comes up in the story, but not as a main lens to look at this.
And you do see Ellen having body dysmorphia because she doesn't realize what she looks like.
Yeah.
So does body dysmorphia, I'm getting all up in this.
No, this is what we need to talk about, right? Let's talk about it.
So with body dysmorphia, does that mean that, we've all seen reality shows that show people who are near death because they're 700 pounds having to lose the weight. So do they also have body dysmorphia in that they don't think they're as heavy as they are?
That's an excellent question, Carrie. I've never thought about that.
Because
I don't know of anything that I've read or talked with other people, listened to lectures about that.
There is so much denial there in that, well, now I can't walk and my family has to bring me food. And if they don't bring me food, I get very angry with them and say horrible things to them. At a certain point, it's like, okay, how do you not see that you have a medical issue?
But that's got to be a very minute, selective portion of the people who kind of experience that. The majority of them will look in the mirror and feel like they're not skinny enough. Or another big group that has body dysmorphia is weightlifters, bodybuilders.
Yes.
They will push themselves to the limit because they're not big enough. They're not bulky enough. Their muscles aren't, when they pose, are not looking a certain way.
Years and years ago, I knew someone whose sister-in-law would do bodybuilding competitions. And she finally had to stop because she limited her food so much and was worked out so much that it affected her personality. And when she was training for those, she and her husband fought, lots of tension because of that. And she did several. I think she might have been ranked nationally, but there's a lot of denying yourself food and denying that, oh man, I don't feel good. I probably shouldn't do this.
Right. But that is not so much with those folks. They are trying to sculpt their bodies into what they think is the perfect body form. And, usually people who are physically active like that and are fit, they're going to be more...
To be type A, they're very much goal setters and they will make sure that they reach those goals.
Right. I think the people that go to this extreme, definitely. I guess what I was trying to say about their bodies was that they're going to be naturally slimmer, but they're going to bulk up their muscles. It's just a different way of looking at it, I guess.
Yeah.
But also unhealthy. If you push it to your limits physically and you're trying to achieve something that your body, you've achieved it, but you're just striving for more, that's unhealthy too.
Are there any commonalities in eating disorders? Can you give just a basic, okay, eating disorders have these things in common besides the body dysmorphia?
I would have to look up the DSM criteria to be really specific, but like I said, we look at it as disordered eating. So the common trends between all of them.
It's hard because everyone is an individual and it affects them in different ways. So
because you can't quite say that binge eating disorder is the opposite of anorexia, because people who binge eat will also go through periods where they're restricting, but the primary thing is they can't control the restrictions and they binge. Not every person who does have binge eating disorder will have periods of restricting, but a lot of them do. It's certainly an area that I am not super familiar with compared to other disorders, but it's one where I am trying to learn more and to be better with my own practice of how I approach people with it.
And, from us, there's no judgment of anyone who struggles with that because I come from a land of heavy people.
Right.
A lot of the women in my family, we all look the same. So I don't want anyone to think that we're being judgmental or uncaring or just blowing people off. But I do have questions, you know,
Yeah.
as a layperson. So I hope I'm being respectful.
Yeah, no, and I want to kind of speak more about that here in a second, but I was incorrect earlier when I said that Eating Disorders Awareness Week, shortened to EDAW, that it started on February 26th. It actually starts on Monday 24th and goes through Sunday, March 2nd. The National Eating Disorders Association.
And that's a trusted source.
I would say it's trusted. I'm looking at it, and they're kind of clinician led. The National Eating Disorders Association has a screening tool if you want. I wanted to look up statistics.
Well, that was one of the questions I had, was the percentage of people who are affected either in our country or worldwide, whichever numbers you have, and what are the percentages of men versus women? Because I know men are overlooked with eating disorders.
So when I'm looking these statistics up on the National Eating Disorders website, 9% of the U.S. population will have an eating disorder in their lifetime. That's approximately 28.8 million Americans. And then the lifetime prevalence compared, approximately 8% among females will have an eating disorder and 4% of males. Definitely more women than men. However, I'm surprised that it's 4% of men.
Because they say it's underdiagnosed.
Right. The global eating disorder prevalence has increased from 3.5% to 7.8% between 2000 and 2018. So that's around the world. That's not just the United States. It looks like 22% of children and adolescents worldwide show disordered eating. When we're talking about the main character, Ellen, which we'll discuss her a little bit more, her younger sister, her half-sister, Kelly, just says to her, well, just eat. Can't you just eat? And Ellen says, I try. I eat, but it's just not enough.
Okay. I had a thought, but we'll come back to it when
Okay.
we talk about Kelly.
Okay.
Is there a certain age, like mental illnesses are often diagnosed in your early 20s?
Yeah.
That's when they present. What about eating disorders?
So the statistics on that, the information that we have is not super clear. What I have been able to find is that most eating disorders are diagnosed between the ages of 12 and 20. But for the people who get that diagnosis, they're usually starting to have their disordered eating before the age of 12, if they get a diagnosis.
Okay.
But kids as young as 6 are impressionable how people eat and then how that's affecting their body. Like at that age, they're putting those things together, especially girls that are as the age of 6 and above reported thinking there's a connection between eating less and being skinny and being pretty and being like all of those thoughts. I found that when I was looking up information.
As long as I've been alive, people have been obsessed with being thin or thinner or thinking they're, heavy.
Right.
I would think, I know a lot of my thoughts and ideas about food came from when I was young. And, the women in my family were all on diet or they had Dexatrim, which...
Oh, girl, that's a throwback. I've heard that before.
Amphetamines,
Yeah.
and that the doctor had prescribed.
Yeah.
And I can tell you, they weren't happy when they didn't get them anymore.
I know.
But I guess for me, it was just in the air. You're at dinner, family dinner, and the topic is how, I shouldn't eat this.
Yeah.
None of us should be eating this. Mm-hmm. So there was never a meal where you just enjoyed it. So I guess I'm not surprised that 6-year-olds, because they're looking to their mom or their dad about how they interact with food.
Yeah, I also have had a difficult relationship at times with food. Mm-hmm. Myself, I have struggled with my weight since I reached puberty. So I was always a really skinny kid up until I hit the age of 10. When I got my period, I put on weight. As a female who's got her menstrual cycle, easily 20 pounds, maybe more, I put on, just from the hormone shifts. And then I've never been able to get back to that skinny version of myself that was a prepubescent child, never. Which now as an adult, I realize my hormones changed. I was, as they say, becoming a woman. And so my body naturally wanted to keep weight on. But for the longest time, I had friends who maybe got their period later than I, or whose body types were different than me. And I looked at them and I said, why am I not like them? Girls growing up, I'm why am I not skinny like that? Or
so then you assume it's your fault.
Absolutely. Guilt. Which that's a big theme in this movie I wanted to talk about.
Yeah. Well, and I've struggled with my weight my whole life, up and down and all around. Mm-hmm. But I think I'm at a place now where I'm happy with myself. But of course, there are those days where it's like, because I'm not like what you would call thin, but I've been a lot heavier.
Right.
So I'm just enjoying this moment.
Yeah.
But yeah, and with me, my history with dieting is yo-yo dieting. Like dropping 100 pounds in 5 months.
Which puts a really big strain on your heart. It's not recommended, but
I don't have a heart, so that's fine. I don't have bones, and I don't have a heart.
Yep. Okay, Susanna.
Hey.
Hey, I know.
When I think of how many times in my life I've lost 80 to 100 pounds to then gain it back.
Right.
It's not great.
It's a struggle.
It
puts a
is.
strain on your mental health.
And I am an emotional eater. So I know my dad is the same way. So if something tragic or stressful has happened in the family, my dad and I will be in the kitchen at night, and I'll just look at him and I'll say, you start in those cabinets, I'll start over here, and we'll meet in the middle.
Absolutely.
Because that's absolutely what both of us would rather do.
There's a reason we call it comfort food. There's a reason that common phrase in our vernacular. It has meaning. There's truth to it, right? Now, whether that is a good thing or a bad thing, it is what it is. And so I think that you can get comfort from food, but really maybe sharing a meal with people, right? Like if you think about people like eating a lot of food like in private, like, because I mean, listen, I'll admit something I've done myself, but it was more so when I was younger, and I would eat like candy. Like if I was craving sugar, I would eat it, but I would hide it from people. Like I didn't want them to see me eat like down 3 candy bars in like one go. And I'm not talking like the mini candy bars. I'm talking about big ones, right? Like there's a lot of shame and guilt that can come along with disordered eating.
Yeah. And also, like for me, when I was in high school and early 20s, when I was living at home, it was like I would wait for my parents to go to bed and then go in the kitchen and fix a sandwich or whatever.
Right.
And just hide that.
Right.
For some reason, I thought, oh, they won't notice that this whole loaf of bread is going to disappear in 3 days. It's going to be fine.
How could they not miss that bread?
Yeah. I mean, I don't know if that ever goes away, that like looking in the mirror and being like, oh my God, I went out in public today. But
I don't know. I think you can reach that. I think you can achieve that. I think it's possible.
I think I'm fine. And it's just like all of a sudden I'll just walk by a mirror and be like, holy shit, what was that?
I think that goes to just how pervasive these thought patterns can be.
Yeah.
And how they're like little worms in the brain. You can't get rid of them. You can't eradicate them completely anyway.
Yeah. I have a question.
Sure, what's your question?
I have so many.
Okay. I like questions.
Well, I was wondering if there were socioeconomic factors that, like our upper class, the wealthy, are they more likely, or middle class, or the
that is a great question.
Or the poorer?
I should let you keep speaking before I interrupt you.
That's okay. I'm used to it. Everybody does it.
Are you trying to tell me something?
No.
Why don't you repeat your question again?
I was wondering if there was a socioeconomic part of eating disorders. So are the wealthy more likely or less likely? Are the middle class more or less likely? Are those who struggle with money, are they more likely?
So, actually, I think that's a really good question, Carrie, and I think for our next episode after this, I'm going to research it and come back to it, and I'll bring it up when we talk about the next movie. However, from my experience with people who have had eating disorders, I do think that it's probably, unfortunately, maybe a pretty equitable disorder to have amongst people, no matter what your socioeconomic status is.
I guess I was just thinking of people who lived through the Great Depression.
Oh.
Or my family comes from Hollers in Kentucky and West Virginia. And you watch footage from the 40s and 50s, and there wasn't food. They were boiling weeds to try to get any sort of nourishment. And those, they were so thin. So to me, that would be circumstance, the circumstances led to that. However, I watch a lot of hoarders. I don't know why.
Love that show. It's one of TLC's best shows. Yeah.
And you would find elderly people who would open cans of food, and they never threw away food because they grew up with food insecurity.
Right.
They would possibly, even though they could eat, they were like, well, what if something happens?
Right. I don't know if this is the point you're trying to make, but I will say that hoarding as a behavior has a lot more connection to OCD than I would say like eating disorders. I'm sure that there's a lot of overlap. I mean, you can, again.
So that wouldn't necessarily be an eating disorder. That's something, a trauma they experienced as a child that they don't want. They're just safeguarding against that.
Yeah, they probably have. So with OCD, there's a component of having intrusive thoughts. So the intrusive thought for someone who lived through the Great Depression or has lived through times of extreme financial stress, maybe famine, those types of things, they're going to have intrusive thoughts that it's going to happen again. So what do they do to prepare for that?
Yeah.
They're going to hoard. They're not going to throw anything away because they might need it on some level.
Yeah.
So, I think that can affect the way that they eat, but not as like the main way that they present that. The main way that they...
Is that just not the main issue?
It's not the main issue. The issue comes back to these intrusive thoughts, that anxiety, and the compulsion. OCD is a very unique mental health disorder because it's got two things. It's got anxious thoughts and it's got compulsive behaviors that create these vicious cycles.
Are there typical mental health struggles that people with eating disorders have?
OCD,
Okay.
PTSD. We already talked about body dysmorphia, depression, anxiety, for the most part. And so usually personality disorders as well. I know. Which we talked about borderline in the last episode, probably to death. Nobody ever wants to hear about it again. But yeah, personality disorders, particularly borderline, obsessive compulsive personality disorders, another one that they could have. They might not have like OCD to the point where they're having like rituals, but if there's differences between obsessive compulsive personality disorder and OCD. With obsessive compulsive personality disorder, there's obsession with perfection. And so if you think about the body, people with eating disorders are trying to attain a perfect body in their mind, what it is. And so there's a lot of overlap with those.
When did that get included in the DSM?
I want to say the DSM-3,
Okay.
but while we're talking, I'm going to check that out.
What were the attitudes like? I know you didn't practice back then, but...
I know, right?
But...
my ghost did. In my past lives, I've always practiced.
But I'm just wondering, has there been a shift in attitude by the medical profession towards people with, like, is there more compassion now? Like in the 60s, were you getting any compassion? Or is it just, no, we're going to put a tube in your nose and you're going to have to eat that way?
We've come up with better treatments. We've been able to research it. We've pinpointed it, right? We've pinpointed a group of disorders. And that's the thing that people maybe need to realize when we're looking at research and trying to progress treatment, move it forward. The way that we study it, we have to define the parameters of what we're studying. So when people come up with these clinical trials of, let's say it's for a therapy and maybe not a medication, which is what I'm more used to, you have to identify people either by their symptom profile, which is a thing you could do, but more often than not, they're finding people who are diagnosed with certain things to then apply a treatment and see if they get better and look at what their research comes up with. Okay, so real quick, I did a real quick search because I wasn't sure when eating disorders as a category was added to the DSM. They added it in 1980.
Okay.
That's when it had its own category.
And the 80s was a wild time to be in elementary and early junior high, because those, the after-school specials and movies of the week, there were so many that dealt with eating disorders.
Yeah.
And I wonder if it's because it had been recognized in 1980 as a disorder.
Well, and I wonder if, that's very possible, but I'm also wondering if what happened with Karen Carpenter.
Yes.
And I don't remember the context of it, but when I was looking up my very light research of To the Bone, it was being compared to documentaries that were done of Karen Carpenter and how she starved herself to death.
Yes, and my dad has always been a huge fan of the Carpenters, so I grew up, like, when the movie of the week about her life was on in the 80s, we watched it, and she was so gifted as a singer. And all it took was when she started out as a drummer for her brother in the group. When it first started, he was on piano, she was on drums, and then she came out from behind the drums to sing. And I don't know all the exact details, but either someone from a radio station who interviewed them or a magazine article called her his chubby kid sister. And that set it off.
Yeah.
But you also see that, I think there were a lot of expectations on her growing up anyway.
She was in the music industry.
Yeah.
Yeah. And if you think about, let's just think about the music industry. When we're not even talking about film, which is, purpose of our podcast is to talk about. But if we're talking about that part of culture consumption, think about, again, I don't know if he had an eating disorder, but think about like Michael Jackson, and the kind of pressure he felt as a young performer growing up.
And he started when he was like 4 or 5. I couldn't.
But he changed his whole body to what he thought people wanted from him, what he wanted from himself. And so I'm sure Karen Carpenter felt somewhat of a similar pressure.
If you go onto YouTube and look up any of archival footage of her, interviews, and there are some documentaries that were done. I mean, she was someone who you looked at and you're like, how can someone still be alive and be that sick?
Right.
Just tons of compassion for her. Because, I mean, as women and as men, which I don't think we recognize enough,
Right.
we all have pressure put on us from family, society, ourselves, of how we're supposed to look to be presentable. Because I sang a lot when I was younger. And would go out to coffee houses and stuff. And, it was made very clear to me on quite a few occasions, you have a great voice. Oh, God, we love to come to your little thing. You'll never make it because you're heavier. It's like, yeah, you're talented, but no one will want to listen because you don't look a certain way.
Do you think that's changed?
No.
Okay.
Now, listen. You can throw out examples like Adele.
Oh, that's who I was going to come up with.
However, she...
Lost weight recently.
Lost all that, and good for her.
Right.
I mean, my God, I don't know her. I don't know her medical issues.
I'm shocked you don't know Adele, personally.
I know. Right. I personally think we would be besties.
Probably.
But whatever.
Adele, if you're listening.
I won't get into that bitterness of us not being besties. And a lot of her fans were really mad at her.
Right.
And how unfair was that for women to say, no, but you're like our hero because you're heavier.
Right.
To me, two sides of the same coin of saying, well, you have to be thin for anyone to like you. So it's like, which is it? And at the end of the day, we don't know her private life or why she... And also, just being unhappy is enough of a reason.
Exactly. Well, and it's unfair for people to say to Adele, you need to be heavier because
I made me feel good.
Right, yeah, I want that representation of something, my body in the music industry, which I think I am pro inclusion of all body types because all bodies are different. I'll be the first one to say that how much you weigh is not equivalent to your body being ill. We talk about Ellen, the main character, played by Lily Collins in this movie, about her being ill because of how skinny she was. And we've talked about like my 600-pound life and about how those people are probably not the healthiest. But I'm the first one to say your weight is not equivalent to that. But the thing to keep in mind is if your weight contributing to your body not being well, which we would see that with like your vital signs, we would see that with lab work, we would see that with you developing certain other medical conditions that might be along with your weight. Like that's when it's a conversation that needs to be had. But you should not equate weight to health. Either way, too little or too much. Yeah.
Yeah. Is it true? I don't know if I heard this in the movie or if I heard it when I was looking things up for it. Are eating disorders like anorexia, I guess any of them, I read that they have the highest death rate
Absolutely.
of any mental illness.
It's actually number 2. So
what's number 1?
I don't know. Hold on. Let me bring up my statistics. So it is, side note, when we're talking about eating disorders and death, every 52 minutes, one person dies as a direct consequence of an eating disorder. That's as of 2019. Oh, no, you're right. Officially, anorexia has the highest death rate of all mental illnesses.
What?
I mean, it is terminal. It's considered like if you do not get better, it can be terminal.
Are there other mental illnesses? Because I've always wondered if certain mental illnesses have a greater likelihood
Right.
of dying from them. And are other mental illnesses terminal? And I mean, I always thought like depression might be considered.
So it looks like if we're going to include with mental health disorders, substance use disorders, it looks like the highest of all time, anorexia nervosa, and then second, substance use disorders after that. And then I guess honorable mentions, I guess we would say, ones that have a high risk of death is borderline personality disorder, depression, bipolar disorder. Those are the top ones.
That's scary.
It is kind of scary. This is from World Psychiatry. There's an article published about risks of all cause and with suicide and mortality in mental health disorders. It was a meta review.
Well, that's...
Yeah, lovely. It's uplifting.
It's interesting. We're a happy group.
Yeah.
It's interesting to think of... I don't think most people think of anorexia and bulimia as mental health issues.
Bulimia was not... Oh, no,
Sorry.
I'm sorry. Not bulimia. Were you talking about binge eating or no?
No, I was just talking about... I don't think people normally think that eating disorders are a mental health issue. They just...
Yeah. Not until it gets to the point where we see like Ellen in the movie, right? But I guess that's what I was saying is we're seeing the one side of it, but eating disorders are done mostly in secret.
And so the only way anyone knows is when you've lost so much weight that you can't hide it, which explains a lot of Ellen's clothing choices, I think.
Right.
That concludes the first part of the To the Bone movie discussion. Karen and I had a lengthy conversation about all things To the Bone, and so we've broken this up into 2 parts. Hopefully you enjoyed this first part. Be back tomorrow for the second part. Take care of yourself. And as a reminder, the content in this episode is not intended as medical advice, diagnosis, or treatment. The use of the information on the podcast is at the user's own risk. Listeners should contact your doctor or other qualified medical providers for medical advice.